Hello everyone, I'm Dr. Monica. Today's video will be on cementoenamel junction. So what is cementoenamel junction? Anatomically, cementoenamel junction or CEJ, it represents the area of union between the cementum and enamel at the cervical region of the tooth. So why is cementoenamel junction important? First of all, it is a static landmark that CAJ once formed, it does not change. And CAJ, it is very important to measure the probing pocket depth and to assess the clinical attachment level at the gingiva. Let's understand how cementoenamel junction is formed. It begins with the tooth bud development. From enamel organ, Hertwig's epithelial root sheath is formed from the inner and the outer enamel epithelium. After this, the hers guides the root dentine formation, and it is followed by the fragmentation of hers, which is both irregular in time and space. So this fragmentation, it leads to exposed dentine, which activates the cementoblast, and it leads to the beginning of cementogenesis. At this particular time, periodontal ligament fibers, they start attaching to the root surface, and the cementum which is formed at this point in time, it is the intermediate cementum. So the remaining fragments of the hers, it remains in the periodontal ligament and it converts to the epithelial rest of malaces. So the irregular fragmentation, it leads to irregular CEJ contour. If the hers, it does not fragment, it becomes reduced epithelium and the enamel formation continues, but there is no cementum deposition. So here the main important thing is the interaction and the fragmentation of the hers. It plays a key role in the formation and the morphology of cementoenamel junction. So coming to the types of cementum relationships that exist at the cementoenamel junction. So we have four patterns. Coming to the pattern 1, in this we can see that the cementum, it overlaps the cervical end of the enamel. So it is seen in about 60 to 65% of cases. So coming to the pattern 2, in this we can see that there is edge to edge butt joint that exists between the enamel and the cementum. So this pattern, it is seen in about 30% of cases. Coming to the pattern 3, in this we can see that the cementum and the enamel, they fail to meet, and this is seen in about 5 to 10% of cases. Due to the exposed dentine, gingival recession occurs, which results in increased sensitivity. So coming to the pattern 4, in this we can see that there is overlapping of enamel on cementum. So it is observed under an optical microscope and it is seen in about 1.6% of cases. So coming to the methods by which cementoenamel junction can be located, coming to the conventional methods, so it includes visual, tactile method, which includes the use of straight explorer, or we can use periodontal probe. Radiographic methods includes IOPA, bite wings, and RVG. The modified methods to locate CEJ includes use of computer-linked electronic constant, pressure probes, Florida probe, interprobe, perioprobe, Berek probe, Toronto automated probe, Jeff-Coat probe, or the Foster-Miller probe. So coming to the curvature of cementoenamel junction. So it is usually of variable pattern. It mainly depends on the height of the contact area above the crown cervix, and it also depends on the labiolingual and the buccolingual diameter of the crown. So we can find that greatest proximal CEJ curvature, it is present on the mesial surface of central incisors. So the CEJ curvature, it decreases moving posteriorly. So the last molars, it has little to no curvature, and the posterior teeth, we can see that the cervical line, it is positioned more occlusally on the lingual than on the facial surface. Coming to the surface specific curvature, the interproximal CJ curvature, it is going to be more as compared to the buccal or the facial curvature. Clinical implication is that increased interproximal curvature, uh, whenever it is present during cal measurement, it is compromised or it is less accurate. So cementoenamel junction in the primary dentition. So in this, the cementum, it overlaps enamel or it is edge to edge. There is no gap present between the enamel and cementum. The thickness of CEJ, it is 40 to 60 micrometer. It is sinus and there is no cells present, and it is thin and rough. The rough surface is due to the presence of calcium spheroids, and the cementoenamel junction in primary teeth, it is protected by gingival connective tissue. During the passive eruption in the growth of the jaw, there is exposure of the cementoenamel junction in the 6 to 10-year-old children. During the prepubertal periodontitis, we can see presence of filamentous bacteria, there is resorption lacunae and calcium oxalate dihydride crystals. So coming to the cementoenamel junction in permanent teeth. In this, the cervical and the root surface lesions involving cementoenamel junction increases, and we can see that it is difficult to obtain teeth with intact root cementum in the permanent teeth, and also there is risk of forceps injury at the cementoenamel junction. So we can find that there are age-related changes which occur after the third decade at the cementoenamel junction. The continuous passive eruption, it compensates for the incisal or the occlusal wear. The consequences of CEG exposure, it is mainly dentine hypersensitivity. We can see tooth abrasion and tooth erosion. So let's now talk about the clinical implications of cementoenamel junction. Firstly, it is a key periodontal landmark. That is, it is a reference point for probing attachment level. So it is essential in periodontal disease assessment. Secondly, the clinical conditions which are associated with cementoenamel junction include gingivitis, gingival recession due to CEG exposure, and there can be loss of periodontal attachment due to this, and there can be cervical sensitivity, caries, and erosion, and it is also important for the placement of restorative margins. So the pattern of cementoenamel junction, it is also relevant for the calculus formation. So any topographic variation, it can lead to the retention of plaque, and which further leads to calculus formation. Also, the location of cementoenamel junction, it is important for accurate clinical attachment level measurement. So it is critical when the CEJ it is altered or obscured. So cementoenamel junction, it is a reference for diagnosing cervical enamel projections. So the enamel extension onto the root, it increases the periodontal disease risk, which disrupts the normal cementum fiber attachment. So coming to the dental surface defects, cementoenamel junction, it guides diagnosis and treatment. If the cementoenamel junction, it is not identifiable, it is difficult to assess the recession depth and width. Also, it is difficult to locate the gingival margin accurately. If you have found the content useful, please like, share and subscribe to this channel. Thank you.